so that you don't give up. You don't have to give up your roti. You have to know how much roti you should eat and how often you should eat roti.
Yeah,
You
that's
don't
it.
have to give up your metai. You can have a metai once a year if that is true, or once a month, but that is not your daily food.
GuyMetro is actually the Guyana Metropolitan Relief Organization. We are a nonprofit that was established in 1991 in the U.S. metro area that includes Maryland, D.C., and Virginia.
We're extremely proud of you here at Voices of Linden TV for all the goodness that you continue to do, and that may each of you continue to be blessed in any way, and may equally the love donations that you ask for come back tenfold in 100 ways.
Thank you.
So,
like, subscribe, and share to Voices of Linden TV.
hi everyone, welcome to the Voices of Linden TV. Today we have joining us members of GuyMetro, which is a nonprofit charitable organization that is focused mainly on healthcare. With the attention-getting numbers of 11% of Guyanese that have been diagnosed with diabetes, it's no wonder that this group is focusing on diabetes on their upcoming trip to Guyana. What gets less noticed, though, are the early warning signs, such as increased thirst, hunger, and wanting to go to the bathroom a lot. Some of the other early signs are yeast infections and darkened color at the back of your neck, and of course, wounds that aren't healing easily. And of course, we want to talk about today, not only about the outreach programs that they have, but how it is that you can pick up these signs earlier so you can avoid further complications in your life. After all, your health is your wealth. So first, I'm going to introduce everyone here today. We have with us Dr. Yonnette Semple-Dormer, Dr. Mark Levy, Terence Monkou, and Marcelle Gilkes. Welcome, everybody.
Thank you.
Thank you.
So first off, we're going to start off with Dr. Yonnette Semple-Dormer, and she's going to be speaking on the mission trip.
Thank you so much, Mrs. Seetram. It is a pleasure to be here and to be able to speak on behalf of GuyMetro. I serve GuyMetro as the president, and GuyMetro is actually the Guyana Metropolitan Relief Organization. We are a nonprofit that was established in 1991 in the U.S. metro area that includes Maryland, D.C., and Virginia. And as you heard earlier, our focus is really on the helping to control and manage and even reverse the diseases such as diabetes, lifestyle diseases. And our organization has an executive that meets on a monthly basis to plan these activities that will help to improve the lives of our people. We also have a 501c3 status that gives us the opportunity to raise finances to fund our mission. So GuyMetro has funded a lot of projects, such as supporting the fight against diabetes and dental diseases. Additionally, the organization has purchased beds and improved water filtration and respiratory machinery at Davis Memorial Hospital. But we get right back into our focus because in 2021 and 2022, a group of professionals took the mission trip back to Guyana. And in 2022, we reopened the diabetes clinic at the Davis Memorial Hospital. And at this clinic, the clinic opening, we had lots of government officials, representatives from the Lions Club and the Ministry of Health who were there to reestablish this free clinic for our people who are battling diabetes in such large numbers. And because of that, we are again organizing a group of professionals, 60 plus professionals that include surgeons and doctors and dentists and ophthalmologists and pharmacists and occupational therapists and medical technicians and educators. And we are going back into the field, into Guyana, on July 18th to the 31st to work with our people to provide services that will help improve their quality of life, especially around the disease of diabetes. So our theme for the mission trip is Your Wellness, Your Wealth. And we want you to know that a diagnosis of diabetes doesn't mean the end of the world, that you can first manage the way you live, manage the disease, get the help you need so that you can have a quality of life that you will be able to live and enjoy what life offers. So here's what we are planning. These are the locations that we are going to be in as we move forward with our mission trip. On January 21st, we are organizing a massive health fair that will be held at the National Exhibition Center at Sophia. We're inviting the community to come out in droves. We have a children-focused aspect of the fair with bounce castles and face painting and education for the community. We're going to do vision testing, and we're going to do blood testing and sugar testing. We're going to do lots of activities that help you to improve your health. So we're inviting you to come out and participate in this free venture so that you can live a life that is healthy and wealthy. Then on July 22nd, we are going to be in Georgetown again at the Davis Memorial Hospital. We're working through being at a Georgetown Hospital and at certain schools where we're going to provide surgery and other health services that address your needs. An occupational therapist will be there and provide rehab and sensory strategies for children. And then Tuesday, July 23rd, we'll be in Lenora. We'll be at Lenora Technical Institute at East Bank, in the East Bank Essequibo. And we are going to again be providing these wonderful services free of cost to the community. Then Wednesday, we'll split a little bit and do part of our group will be in Lenora. The other part will be in Linden. Yes, we'll be in Linden. Yay! And we invite the Lindeners to come out and get access to the services we'll be offering. Thursday, we head to New Amsterdam, where we'll be at Winning Primary School. And then Friday, we'll be at Good Hope and Pleasance, providing those wonderful services again. Now, some of our group is going to head to Suriname to do some healthcare work there as well. So we are very, very excited about this mission trip, the opportunities that it's going to bring to our people, the kind of lives that we are going to be able to touch, and the fulfillment we'll get by being a part of this event.
Absolutely. I would encourage everyone to attend. Now, I do have to ask, will there be an itinerary somewhere so that the public can know where you'll be at in advance?
Yes, certainly. We are going to have the itinerary available on the radio. We're going to publicize it in the different communities so that people will have access and they can follow us wherever we are. We are going to be publicizing it on a daily basis, and so you will be aware.
Please do share it with us, because we would love to be sharing it with everyone at the same time. I want to help in any way I can to make this a success, because as much as Guyana is moving in a certain direction, we're all aware that there's much of the public that does not have access or know how to have access to what they need to live a better life. So that's quite exciting, and we're excited to play any part in it and to add on to the great things you guys are doing. And also, in terms of surgeries, do you already have people pre-selected? Like, how do you determine who benefits from it?
Right. We are working in collaboration with the Chief Medical Officer of Guyana. And so we will have those individuals that were selected at the Georgetown Hospital and New Amsterdam Hospital, and work in collaboration with those doctors to provide those surgeries.
Oh, thank you for that. That's great news. And so we're going to move on to Dr. Mark Levy. And Mark, you're going to be speaking about funding and how one can donate into helping, because all of you are doing this out of the goodness of your heart. And of course, your funds are what's needed to make everything even more better. So please go right ahead.
I think after listening to Dr. Yonnette explain about all the things that will be happening, I'm sure people are putting their hands in their pockets already. This operation needs a lot of funding, and I must say that every individual who is going to be in Guyana is funding their own way trip to Guyana, both airfare, hotel accommodation, and other expenses. This is a sacrifice, so to speak, that individuals are making so that Guyanese, particularly those with diabetes, can receive benefits and receive the help and support, medical support that they need. GuyMetro has been doing this, as was pointed out, for many years, and we work with Davis Memorial Hospital. We run a diabetes clinic there with a doctor and nurses that help to support that clinic. And many individuals are receiving treatment, receiving support. One of the key things that we focus on as an organization is education. And we feel that and believe strongly that when people are educated about a particular illness, it would help them make the right decisions, make the right choices that can help them to improve their health. For instance, we shipped a container down to Guyana with supplies, with items that we can distribute to individuals. And that is a cost. Getting the supplies, shipping it down costs thousands of dollars. And so we do fundraisers frequently to help us to purchase items for these mission trips. And we have a number of individuals that support us by making donations, some of them on a regular basis, some of them not so, to particular projects that we're working with. And we're looking for other individuals to support other big projects that we're thinking about. And here's something that we're thinking about. Many of the individuals who have diabetes in Guyana are in outlying areas, and some of them cannot get to Georgetown, to Davis Memorial Hospital, where the clinic is held. We have cells outside in different areas in Guyana, but what we're thinking about is having a mobile clinic that will be able to get around to communities around Guyana to be able to address the needs of more individuals suffering from diabetes. This is going to cost us a lot of money, and we're talking probably $100,000+ to acquire such a vehicle, because we're looking to not just have something to drive to places, but something that we can use for medical treatment, drawing blood and storage of stuff. And it's going to be a clinic so that people can receive certain basic treatments from that mobile vehicle. And so this is going to be our next big project that we'll be working on. And we are looking for big supporters, businesses in Guyana. I know diabetes is not something that attacks selected people. It's a wide variety of individuals in Guyana. And if you look at the data, individuals can go online and look at the data. It's every segment of our population in Guyana suffers from diabetes. And this is something that is treatable, it's reversible. And we are hoping that through our educational program, lifestyle changes, and so on, we can make a big change in terms of the reducing the percentage of our population that is affected by this. And we should also know that individuals, parents and grandparents who suffer from diabetes, that is something that generations to follow can be affected by if we don't take the measures now to prevent that from happening. And so this is our plan, that in the near future, when any survey or statistics are looked at, our percentage would be decreased overall in the population in Guyana. So help us in terms of getting funding. If you listen to this program, you'd like to make a donation, you can make a donation to treasurer@guymetro.org, or you can write a check and send it to GuyMetro. And I guess later on we're going to provide that address
Yes, we will.
from our president, so that we can have funds to make sure that these goals that we have are reached.
Oh, thank you, Mark. So in terms of making that lifestyle change, and of course, as Mark mentioned, all of this is being done from everyone's heart and of course their pocketbooks. So and especially with diabetes affecting so many people in not only Guyana but worldwide, and it being generational, I do have to ask this. Your charity has been around since 1991, and it's such a serious topic that I feel like I should ask it. Do you see the percentages reducing, or have you seen it increase?
I think I know Dr. Yonnette would want to respond to this, but let me say that over the years, we have been trying to reach a greater percentage of the population. Right. We have created workbooks to educate Guyanese about the changes that they can make in lifestyle to improve their diabetic situation. While though our efforts are not reaching the masses in Guyana, over time we have reached a significant percentage of the Guyanese population, but not enough to impact that percentage. I know that there are lots of individuals who have been educated and they have passed that down to other individuals, but we want to make a greater impact. And this is why we're trying to use the mobile clinic that will go around and not just provide treatment and examinations and so on, but also provide education to the Guyanese population. And I think one of the things that we know about in Guyana is when one person learns something, every neighbor is going to find out about it. So we're hoping that in having this mobile clinic staffed with medical personnel and going out there and reaching different communities regularly, it can help to make a big difference in Guyana.
Well,
but again, we need funding.
Yes, funding. We need funding for everything. Money can do so much good.
Yes.
So much good.
You know, I can add a little bit to what Dr. Levy just shared. Recently, since we reopened the clinic, we were able to conduct some research using surveys to find out the impact of our services on the Guyanese community. And we have just collected those surveys, and right now, assessing them to see how we have been doing. And that would also help us to expand our impact in Guyana, because we are using a very unique approach of lifestyle change. We are educating so that you can change your lifestyle rather than depending on the medication that a lot of people affected by diabetes would do. So, collecting the data that speaks to your question of the impact that we are having in Guyana will help us to be able to receive funding, additional funding, to provide extended services to our people back home.
Does the government help at all in any of the funding with all the great work you guys are doing?
I think with the recently we have begun to establish a relationship with the Ministry of Health, and we have made a connection, but we're trying to connect with the Ministry of Health in terms of having a sit-down meeting where we can talk about our plans and how we can work together to reduce the incidence of diabetes in Guyana.
Oh, absolutely. I would think that they'd be so happy to have 60 human beings that are so happy and excited to share all their knowledge and care in terms of our citizens, regardless if you're a former Guyanese or not. So anyone listening out there that can have some sort of inspirational words to give to whoever needs to hear it, we need to act on this as soon as possible, because I think having a medical center on wheels is a fantastic idea, because on wheels, on boat, however, just get it there. You know, saving lives is so important, and changing lives are even more important. So that would lead us to our registered nurse on our panel today, Terence Monkou. So Terence, what can we do to make things better?
Oh, we can do lots of things. And I'm glad that you made a reference to mobility. In other words, probably we'll have to probably get some water cars that can run on the river and take this message of health, the health principle, which I think I heard you made reference to, and Yonnette made a reference to it, that health is wealth. Although Guyana is declared one of the fastest growing economy in the world, I want to use Guyana's statistics to ensure that we can create a change from diabetes. You know, we are not going to only work on reversal, but that's what our goal is, but we want to look at the prevention aspect of it. So we want to address pre-diabetics and we want to address diabetics. Those are the two groups I am interested in. And I believe that if we can get their attention, and that's what I think you can do for us, how to get the attention of the people, how to let them know that we are available to help them, how to use a simple workbook, how to meet in a group at the beginning once a week and share your experience, and also you share with others well what you are doing. Now, I want to emphasize Guyana's richness in fruits and vegetables. And I know diabetics are sometimes worried or concerned that they can't eat this and they can't eat that. But I want no longer do we push that idea of saying to make diabetes look as though it's a diet restriction. We want to teach them how to make choices, how to control the amount of food that they eat, and how to win the hearts of people who are in the restaurant business to prepare foods that when they walk in, they can make their own choice, how they can customize in a restaurant. So when you walk in there, you can say, well, I like to have this. Can you make this adjustment for me? And so the idea of our program, as you've heard before, is education. And I believe with all my heart that education, it is what will culture the exercise of the will. The more informed you are, the better you are able to make the decision. And that is what we want to bring to group dynamics is one way. You said that 11%, and I've heard the idea that 6 out of 10 Guyanese are diabetics. But I want to change that. I want to make Guyana the place where it will all begin, to be the center, to be the place where the other part of the Caribbean can get the model. Guyana will be the model to fight diabetes, and then we can take it, then we can make it a Caribbean Basin initiative. We want to start in Guyana because we believe health is wealth.
It certainly is. But the thing is, like, changing the mindset of people that are so accustomed to rice and egg balls. I haven't had one in years. And roti and dal puri and all those things, the things like, oh my gosh, I have not had a mithai in so long. And, I everything that we're so accustomed to. But I think gone are the days where people used to ride to work and walk to work and do so many things that we used to do. And I find like no one's really making roti at home anymore. Everyone's buying it from somewhere. You don't know what they're using to make it. But I agree, lifestyle changes because not only diabetes, but so many other health factors changes your own body and how your body reacts to it later on. And whether you're gluten-free or you can't handle, if you've had your gallbladder taken out, you can't eat certain foods anymore. Something might be spicy and it irritates you. I think that it's going to definitely be an adjustment, because I'm happy that you mentioned about, Guyana, we're progressing in a certain way, as we're being told in the world, and we're seeing it happening so fast in front of our eyes. But the reality on the ground is not the case. The affordability of what someone can do with their dollar can only go so much further in terms of, and that's the reality of it. And I like to stay in the realistic world, unfortunately, of what it is. But I do believe that what impacts us personally is what makes the change. And it's us that has to decide what it is, who we're going to end up buying from at the end of the day if we have to eat out. And so we're going to start probably searching for all the, what do they call it? The Irie foods, the vegetarian guys on the corner might become more popular probably because they have the healthiest pumpkin soup and fish broth soup or all the good things for you. But I do have to ask this. In terms of from when someone gets diagnosed, or even if they're noticing some of the early signs, how do you get someone to understand that this is not a matter of a choice? This is a matter of a must, that you must make these changes as soon as possible. What would be some of the simple things that they can start maybe doing to make an alternative outcome?
I think one of the simplest thing they can do is to get regular checkup. And I would want to encourage that everybody has a meeting with a physician at least once a year. And then if you are diagnosed, then it cannot be yearly. It's got to be a little bit more frequent, maybe every 90 days. If you are a diabetic that has the inability to manage your sugar, then a frequent meeting with your doctor. Assessment. Assessment is one of the things that can give you the cutting edge. And so we look for that opportunity to see, well, what type of regular meeting does that person have? And if they can get their blood sugar checked, even if it's once a week, because one of the challenges for diabetics is that it's not getting a machine that can check your blood sugar. It's getting a strip to maintain frequent blood sugar check. And we don't want to force an individual into that type of situation. So what we do is, first of all, have them being screened, and we provide them with an opportunity to give them menus so that you don't give up. You don't have to give up your roti. You have to know how much roti you should eat and how often you should eat roti.
Yeah,
you don't have to give up your metai. You can have a metai once a year if that is true, or once a month, but that is not your daily food. We are looking at the daily food, the daily allowance. That's what we mean by lifestyle. What food should be in your diabetic plate? One of the things that I was introducing to Guyana is the plate. Because the plate is a way that shows you what portion belongs where. And if everybody can have a plate, a diabetic plate, it might be one of the greatest things that we can offer Guyana. And I've been pushing that, a diabetic plate, because that is portion oriented. And Guyanese need, I don't want you to give up your rice either, portion oriented. That is my goal.
I look forward to you sharing with me, and I promise to do my part to share with everyone on my Facebook what a diabetic plate looks like and with in terms of even a diabetic menu. And I don't really know of anyone that I think I've interviewed a few people that have diabetes or wears the thing on their arm. I more have people with blood pressure in my family more than diabetes. And even to read the stats on it, it is shocking because what one can have in terms of a heart attack, and we all know someone who's passed from a heart attack, can actually have some diabetic signs of diabetes in there that could have prevented the heart attack from happening in the first place. So all the more reasons as to why. So yes, please do share this diabetic plate. And the reason that I mentioned mithai and roti, you did exactly what I wanted you to do. I guess at the end of the day, it's everything in moderation, and it's almost like an exciting thing to have it once a month or once every 2 months when you really get to enjoy the finer things in life. When the mithai becomes a sign of the finer things in life.
Avoid a high increase in fat because it is not sugar that causes diabetes. And if you know how to control fat, pinch it. If you can do fat-free cooking, you are better off.
But many of us do come up. It's the number one thing. We either try to ignore it. We think it really will not happen to us because we're so invincible and it can happen to everyone around us, but not us. But the truth is, we are just like everyone else. We have fears just like everyone else, vulnerability just like everybody else, and we all like nice things just like everyone else. But we also want to be healthy, and look good doesn't necessarily have to be a certain structure, but feel good is the best thing when you have that energy to go out there and join 60 other people going to Guyana to do something good, to go out there to share the word, tell a friend, tell a friend, tell a friend, because I'm 100% sure that when you have someone that attends one of your outreach programs, or the world is so small that you do not know who in the little bushy parts of Guyana that you're taking a mobile boat or mobile wheels to and you're accessing, that you would have made such an impact on someone's energy level, on their life, to be able to then go and turn around and then donate. And then with that, we have more lifestyle changes and effective change that so catches the eye of government agencies and other donors that you have more and more doctors and GuyMetro doctors, most of all, because they started it so long ago, coming back to help us. I am happy to help in anything Guyana, anything Linden, anything people.
Mm-hmm.
So my heart is always open that way. It will always be. We all have a journey. I'm sure every single one of you, along with the 56 other people that are joining you on this trip, have something inside their lives that would have given them the ability to embark. I myself am heading to Ghana on the 24th from my own pocketbook to do something that I feel is good. And when you do that, you have to understand it's deeper than just a kindness. It's deeper than just the money. It's that passion for saving lives, but also the passion of the life, which is your own, that it saves. Do you agree?
Yes.
Absolutely.
So with that said, we're going to head on to Marcelle Gilkes. Welcome, Marcelle. And she's going to be talking about all the fun social aspects of the mission. We're calling it the mission trip. I feel like we're heading to space, a brand new galaxy out there. So yes, Marcelle should share with us all the excursions and all the fun things.
Thank you for having us. First, I want to relate to something that you said, that you and Yonnette had a discussion about what you should put in your world, a feel for the things that inspires. And so one of the things that we're going to do when we get to Guyana, we're going to have a concert. Okay, we're going to have a concert. Now, the purpose of that concert, because everyone has concerts and everyone has a different theme and a different aim, but the purpose of that concert is supposed to lift people, inspire them, that calm related to the salvation, God's music. And so we're going to have that concert, and we're going to have lots of music. We have some popular artists, and we have some unknown artists who will soon become popular through this venture. And so we're inviting anyone who's going to be in Georgetown, Guyana at that time to come to the Central SDA Church it's in Ornock Street, Queenstown. We have violinists, we have somebody who plays the saxophone, we have lots and lots of great singers. And so that's our first way of embarking on that inspiration that we're talking about. Yeah, we're talking about life coaching and how we can become better. But then music, Shakespeare say, if music be the food of love, you
Food.
can
Yeah.
stay on. And so we're going to have that kind of music so that our viewers and those who attend will be inspired. They'll be that hope that we look forward to, that passion that we can relate to, that comes with music that is heavenly.
Well,
So
it's
that
amazing because you said hope, the word hope just now. And I once read a quote that said, health is hope. And when you have hope, you have everything.
when you have
So,
music, you add to that.
music is energy. It's a message in lyrics.
Yes, it is. So the concept is important for salvation through the power of God's music.
Mm.
So through that, we're going to share the goodness of Jesus.
Mm.
That's the first part of it. Now, if you want to ask me any questions about the concert, you can
Well,
at this
I'm
time
pretty
before
sure
I
Jesus.
go up.
I'm pretty sure Jesus. We say peace be unto him. Would say, bring your cash. Bring your cash and checkbooks are welcome, because the concert is free. And I do know from Yonnette that you're also having on July 21st. I'm guessing that's at the Sapphire ground. Did I say that correctly? Sapphire?
Yes, you have.
That you're having kind of like where people can bring their kids and activities and any of these things that you are attending, not only so much for the goodness of what it simplifies, but you're going to be providing meals, there'll be activities. And if you were to take your child to daycare or any day camp for a day, we all know what that costs. So whatever would have been the fraction that you would have been taking your child to that, think about bringing some sort of a donation, because while all of this is probably already budgeted, because I am from a business background and we do know that budgets are in place and every number has an activity ties to it. Still remember that whatever money is raised from this is probably going on for something other good that you're continuing to do. So if you are taking part, not only to just come and meet the doctors and taking part in all the activities that you're doing, to remember the donation of any sort. And I'm sure when you're on the ground, you need volunteers. I was going to ask about that because I'm pretty sure that the 60 of you can only do so much in organizing something so big. So I'm pretty sure that if people can volunteer in the goodness of their time, or even in providing transportation, or whatever way they can do in helping to make it all a success. I know Yonnette mentioned that you're having, is it Roy Stewart?
Yes, I was about to tell you about that. Yes, we're having Roy Stewart. But here's something. Before we even go to that Sunday Sapphire event, that concert, we're going to ask people to drop a love offering.
Love offering.
If I say I love you, if I say I love you, but then I have to show something that says I love you. And so we're going to have them give us a love offering at the concert before the Sunday night when we have that Sunday fair, when we have all that stuff. We plan to use these donations because we're going to have people helping in Guyana, who not coming from overseas.
Yeah.
And so we just want to give them back, share the love with that offering. And so we have that Sabbath concert and we have that Sunday. you
Right.
know, where you have an opportunity to say thank you. You don't have to take your child to the daycare. You don't have to find your own form of entertainment, but we'll be providing that for you.
Well, I think that's the human aspect of a charitable organization. Oftentimes we talk about all the great things that are done, but we forget about the people that are doing it. You're all professionals in your own right. And we all know money is time and time is money. But when you take the selflessness of an act of charity and you take the time, and then you have people on the ground
Right.
reiterating the importance of protecting those who are taking care of us. And in a way, you guys are all taking care of us. Might not be directly somebody to me, but I view anybody in Guyana as directly related to me. After all, it is people we care about. We're people to people. So we cannot forget that. And we need to keep you guys healthy and not get run down, because you're all going to leave Guyana after you're from the 18th to the 31st and go back to your normal lives. But yet your mind is still on something you started since 1991. The efforts that a charitable organization, the human beings behind it, put into continuing to be so successful, it is unrecognized sometimes, the efforts that people go into to continue to make it progressive. So in case no one's ever said it to you before, or if you've said it to each other, we're extremely proud of you here at Voices of Linden TV for all the goodness that you continue to do, and that may each of you continue to be blessed in any way, and may equally the love donations that you ask for come back tenfold in 100 ways.
Thank you.
So,
Now get ready for this part, right? This is the after love.
Oh,
If anyone is interested in going to Mainstay, and I don't know if you know about Mainstay, it's in the Essequibo region. It's enough if a whole village wants to go. There are 32 cabins, there's single room, you have Wi-Fi. It's the water is tea colored. This clear sun. Man, look, it would be the best trip you have ever made. So
tell me what's happening there.
that we're gonna have, if you want to visit Mainstay, that would be our last, resort to go to. But we don't want to go alone. We're inviting others to come and join us, at Mainstay. And also there'll be a trip to Suriname. So the entire program, as Dr. Yonnette, Dr. Levy, and Terence points out, it's to change one's life, not only physically and spiritually, but also in the way of being able to learn how to relax, to learn how to eat right, to learn how to do everything. So this trip is exciting, it's fulfilling, it's rewarding, it's off the chain.
Definitely sounds life-changing for sure, and I'm excited that we get to help you guys in promoting this, because July 18th is right around the corner and time flies, and we're going to try to air this as fast as possible. And of course, I will, on my own page, do as much as I can to get it out there for you guys. And of course, we're going to make sure to link Mark, the WW Treasure, where we can make the donations. And then Terence, you're going to give me our diabetic plate and some sort of menu that we can follow along. And is this menu by chance tailored to the Guyanese community in terms of like some pumpkin and some callaloo and or is it generic?
And get some bhaji.
Bhaji. Yes, not callaloo spinach, right? Yes, well, I heard a lot about that dasheen porridge last night.
And just in case you're missing out at the concert, because it's music, it's a part of our medicine, because laughter is good medicine.
Very true, very true. I love that, actually. Laughter and love, everyone needs it, that's for sure. And health, because like we said, health is wealth, and it's your greatest asset. Without it, you can't do anything. And everyone seems to be so motivated today to leave a legacy. Well, you can't really leave a legacy if you're not trying. to do the best you can to maintain your own health. Don't be in such a rush to leave a legacy. People would much more prefer to have you around for much longer than thinking of your after before you've even begun, if you know what I mean. One of the things, Yonnette, from yesterday that you were speaking about is that you are looking to partner with someone who is trained in neonatal resuscitation. I did not want to forget that. Would you like to talk a little bit more about that?
Sure, absolutely. So our nurses at the hospital, Davis Memorial Hospital, are looking for training in the area of neonatal resuscitation. And so far, among our group, we do not have an individual who is able to do that. So we are extending the invitation to you to join us in that area. We would definitely welcome you, and the hospital, who focuses on a lot of maternity and maternity cases, will benefit significantly from that training. So connect with us so we can have you be a part of this event.
While Guyana is ever changing, it is the human beings that make the greatest impact. So please, on your trip home, take care of yourselves, drink lots of water. We need you for many, many, many more years. And enjoy your time, relax on the beach, look at the people's faces that you'll be helping as a great reminder that apart from the funding and the concerts and all things good, the great human beings that you are and how grateful we are that you exist. So thank you so much. I do have one little question in terms of diabetes and glucose levels based on a friend who's going through, a few friends that I think I've seen recently. I was out with a girlfriend and she dropped so fast or something happened that she had to drink a Sprite. And then I have another friend whose numbers fluctuate drastically during a day. What are some of the reasons that these things could happen?
Because sometimes if you're on insulin, and you got to pay attention. Regular meal time is the answer to that question.
A regular meal
you
time.
Yes, and make breakfast your most important meal. If you plan to miss a meal, don't let it be breakfast.
Do you
because
think that,
if you begin the day with food, then you can burn up the extra glucose. But if you stay late to eat, then you are setting up yourself for trouble. Because the body produces insulin too, and if you're taking insulin, then you're likely to get into that what we call an hypoglycemic shock, where the blood sugar is less and the insulin is more.
So
or it could be the other way around.
Early meals, timely meals, and no late meals.
Yeah, that's correct.
Thank you so much for that. I really do appreciate you answering that question. One other thing that I did want to ask that is just for the public, because I know, first of all, everyone, it's free. And I think part of what Dr. Yonnette shared with me yesterday is so I'll walk you through what your day would be like if you're attending one of these outreach clinics. So you would attend the clinic and you would get tested for your diabetes, your sugar levels, your vision care, and some other health care. I'm sure there's others in there. And what the doctors would do if they find that you are in need is not only give you I'm sure some people will just need the diabetic plate, they will just need some food information, some information from Terence and others. And then there are some who will be more further along, sadly, that may have already been heading in a more dire circumstance, and they would need prescription. So from what and some of you, of course, diabetes also causes vision loss. And so if you need a prescription for glasses, then when these wonderful doctors and their partners all head back and everyone head back to the States or wherever you're from, you guys are going to be mailing them back to Guyana for the patients. Is that the case?
That's the case. That's what we plan to do. So we are being very, very strategic. We are not leaving this up to the patient or the client to go find the glasses after we do the testing. Yeah. We are going through the gamut of things and providing them the care that they need so that they can be living the quality of life that they deserve.
Yes. Well, I think
if I can.
Yeah, go ahead.
if I can say something, everybody who comes to our outreach will have a free health profile.
Oh, I love
To
it.
give
What happens
a
when you
free
don't
health
have?
profile.
Would that be something that's like um, technologically advanced or something that?
A little card that can give, so you can look at yourself and say, hey, this is what
Oh,
this is what I am.
perfect.
This
Well,
is
you
who
know
I am.
what? I was just going to
So
say everybody seems to have a cell phone regardless of their health status, it seems in Guyana. So if there's somewhere to have a QR code or a little text thing or something like that. But I love the fact that they'll have a card of their own. It's theirs. It has more medical updated medical status that you may even use if you end up having to go to the doctor in the
that's
future. Yes, yes. But I think there is nowhere that you can go and get that kind of programming that takes care of you from the time you enter to actually delivering the product that's needing for your health directly to you. There's no anybody. So I think that in itself is great because we all know when you tell someone something, they leave and then they get distracted and then they'll never go get the prescription filled. They'll think of the finances. They'll think of colors and this and that. But here you are, you're getting everything basically at your doorstep. All you have to do is show up and take advantage of it. Because after all, that is what they're there for, and they're really all about you. So with that said, I want to say thank you all for allowing us the opportunity to share in these moments about what GuyMetro is all about. Any lasting words, anybody?
Well, we are certainly excited about this trip and excited to connect with the people of Guyana. We invite you, even if you haven't scheduled to be a part of our trip, to come out and help us in any way you can so that this trip can be motivational for those who are professionals and can be life-changing for those who are suffering from diabetes and other diseases.
I'm just going to share how you can donate again. And if you would like to send a donation, you can use Zelle to send it to treasurer@guymetro.org. That's GUYMETRO.org, treasurer@guymetro.org. Or you may write a check and send it to 11515 Old Lotsford Road, Bowie, Maryland, 20721.
We will make sure to have all that information on the link.
Yes.
For sure. Anything to help. And Marcelle, any last words?
Yes, come out to the concert. Bring your offering. Get your offering from the music that we will have waiting for you. Join us at the resort. Come on, you're gonna have a great time.
We will welcome all of our offerings in check or Zelle or cash donations to the concerts, and they've definitely chosen the best of the best, not only in themselves but even the people performing. And even the performances that you've described sounds like something that violinists and saxophones and wonderful music with wonderful messages will touch you deeply, something that creates a memory in more ways than one. And I will now go to Terence for any last words.
I will teach them how to mix it, how to zip it, how to move it, and how to rest it. Those are my 4 life-changing principles. And if you don't get nothing, you will get that. How to mix the food, how to chew your food enough to get the best out of it, how to take deep breathing exercise so you can get more oxygen and better energy, how to move it by having Dr. Yonnette show you how to exercise and how to walk. And then we will teach you how to relax. No more scary movies. And I'm finished.
Yes. Well, thank you for that. I wish I was there with you guys, but I feel like I'm already there with you in spirit. And I cannot wait I will be thinking about that today, how to mix it, how to exercise for it, how to use it, and all the good things. So thank you so much for that, Terence, and all of you. We appreciate you in every single way. So blessings.
They will learn to eat right, move right, sleep right, and look right.
Okay.
Perfect. That's a perfect ending to a perfect interview. So thank you guys once again. So July 18th to the 31st, we will provide an itinerary as fast as we can get it from GuyMetro and their team, and we will do our part. So we just want you all to just attend and go do every single thing and go learn as much as you can and save your own life. And if you feel you don't need it, tell your neighbor and tell your town, tell your village, tell everyone. So just get out there, bring your kids, and just it's never too early to learn something. Knowledge is the key, and this is how we save the world. So thank you everybody for a wonderful Sunday morning, and blessings to all.
Blessings to you, and thank you for having us.